Hi, this is Brian Kim, and I'd like to share with you my very simple, easy, and unique hydrodissection technique. If you learn cataract surgery like me, I used an obtuse right-angled cannula, and I was taught to go underneath the anterior capsular opening and pushing BSS. Sometimes I'd get a wave, sometimes I wouldn't. I'd have to pick different spots, and eventually I'd get a dissection wave, sometimes a delineation wave, which I don't really like to do because that creates another step of removing an epinuclear shell. And so I switched to a right-angled hydrodissection cannula because I felt like I was getting more consistent waves. But even with the right-angled hydrodissection cannula, using it in the traditional approach where you're basically just going right at the edge of the anterior capsular opening, I don't think this is that efficient. And so what I do is I place the cannula out to the equator, just like I do for the horizontal chopper. And so you'll see here, I'm going to place the cannula all the way out to the periphery, and then I'm going to put this under slow motion. I'm going to rotate the cannula tip so it's pointing downward. You can see me rotating the barrel. And as soon as it's pointing down, I'm in the equator. I'm going to push BSS very gently, and without any effort, this dissection wave occurs consistently without any additional movement and manipulation and trying to find different places. So you're going to see I'm going to go to this same place, cannula down, and you see the dissection wave occurs without any fussing and manipulation and having to find additional spots. So again, you go down and around and point the cannula straight back towards the nerve, and the dissection wave occurs without any difficulty. And all these cases were done on the same day last week, and I started off showing you large pupil sizes, and I'm showing you progressively smaller pupil sizes as I'm doing here. Again, you can see me rotating the barrel so the tip of the cannula is pointing down, and you know that you're not going to meet any resistance because you're going out between the capsule and the lens material, because there is a dissection plane there. And when you point that cannula down and it's away from the anterior capsular opening, the BSS has no other place to go except posteriorly. Unfortunately, with traditional dissection techniques, fluid keeps coming anteriorly, and that's the reason why the dissection wave fails. But as you can see, every single time I push BSS, it goes straight back, and you can see that dissection wave. The pupils are getting progressively smaller, just to show you that, yes, I had multiple different pupil sizes throughout this day, and this is the same exact maneuver. Here I was actually pushing, but I was actually pushing too peripherally, and I was catching capsule. So then when I moved it a little bit more centrally away from the capsule and I pushed, the dissection wave occurred fairly easily. So this is my technique for hydrodissection. I feel like this is really easy, simple, and completely reproducible every single time. Place that cannula all the way to the equator, point it down, and you'll get an easy dissection wave. Thank you for your attention.